Hi everybody, it's Dr. Paula Kowalski. I am here with my daughter Harper. She is 2.5 months old. I just want to show you guys what a typical adjustment looks like for, for a baby or for an infant here, and just kind of walk you through it because a lot of people don't know what it looks like and how different it can be from a typical an adult adjustment. So a few things before I get started here. So why get babies adjusted? So the whole birth process, no matter how great of a delivery you have or whether it be C-section or forceps or whatever, there can be a lot of trauma, especially to the neck region. So it's always a good idea to get them adjusted. First and foremost, what an adjustment does is you're helping the nervous system function better. So what that looks like for kiddos, it can be you're optimizing brain development, which is so crucial during these early weeks. You're ensuring they're going to be hitting milestones appropriately, and overall helping everything function better, so every organ functions. So you're basically giving them the best start to life as possible. Along with that, there's a ton of other benefits to chiropractic care, and I'll kind of walk you through that and which areas I focus on while I'm adjusting her. So we'll go ahead and get started. And she is just smiling away, aren't you? She loves getting adjusted. So first, I usually just start in kind of the mid-back region. So with adjustment with kiddos and babies, it's all just gentle pressures. You typically won't hear any little popping or cracking or anything. They just need something really gentle and specific. So I'm just kind of working my way down the mid-back here. So the mid-back is kind of a common area that you like to focus on if the kid is having a lot of reflux or a lot of spitting up, as well as just think kind of like upper stomach area, so a lot of gas as well. That's kind of a common area to focus on. You are just loving this. So kind of working my way down here. She gets adjusted very often between my husband and I. We check her out at least a couple times a week, and she was adjusted from the day she was born, had her first adjustment day 1. So I'm kind of working my way down to her lower back here. So this is kind of a common spot if kiddos have a lot of colic, constipation, those sort of issues. In a toddler, when they get a little bit older, if they're having bedwetting issues, this is also another common spot to kind of look at. Perfect, and then I'm working my way down to the pelvic area here. So I know it looks like I'm not doing a whole lot, but I'm just kind of holding that segment. Just little gentle pressures is all they need. And she honestly feels pretty good because she gets adjusted very often. You talking for everybody? So if there is reflux or constipation or anything, there's some other areas I focus on too. A little bit in the stomach, a little bit the diaphragm area, just kind of depending on what's going on with the kiddo. So she feels pretty good there. I'm gonna check out her neck. So this is probably one of the one of the most important areas is near the skull, upper neck area. That's where a lot of that trauma happens. So this is a really good spot for if the kid is suffering from any ear infections, colic as well, that gassiness. Those are all really important areas to get checked out for that. Okay, just a couple of gentle pressures, and she doesn't have a whole lot going on. She feels pretty good. I'm gonna check out here. Okay, and then the other thing too is typically with kiddos, I like to do a lot of cranial work as well. Basically with cranial work, you're helping brain development as well. It can help with a lot of ear infections depending on what you're working on. If you notice any flattening of the skull or anything, definitely seek out someone who does cranial work. So I'm gonna do a little bit here on her. Like I said, this is all gentle. She loves it. She, doesn't fuss or anything during her adjustments. Oh, just when I was saying that. Okay, so next I'm gonna put her on her stomach and just do a couple more to check out here. Okay, get all that good tummy time in, perfect. She holds her head up nice and good. So I'm kind of checking out that pelvic area a little bit here again. And then same thing, just kind of working my way up. Perfect. And that's it. That's what a typical adjustment looks like. Super gentle. She loved it, and it's really good for them. You're giving them best start to life. You're optimizing all that nerve and brain function. So there we are.